everyone, my name is Miranda Smith, and I'm going to be discussing my analysis for the private insurance market rules. This section at the ACA is really focused on trying to increase access to coverage for individuals who have been unable to get coverage in the past, as well as being able to increase the quality of care these individuals are receiving. So this policy really covers a wide range of issues, and I'm going to mainly just focus on three in this presentation. So the first problem is cost sharing. So in the past, there was lifetime and annual limits put on a dollar limit that was put on the amount of benefits a person could receive in their lifetime or in a year. So if people reached the number of benefits they could receive within a year, then they would not get any more payments from the insurance company. Or if they reached a lifetime limit, some were set at about $1 million. If they reached this $1 million limit, any healthcare expenditures over this amount would no longer be paid by the insurance companies. And so this really left a vulnerable population of people with debilitating diseases or chronic health conditions that met these limits. Not many individuals actually met these limits, but those that did were particularly vulnerable, and then they were unable to have coverage after they met these limits. So the private insurance market rules got rid of the ability of insurance companies to put annual and lifetime limits on their policies. The second problem that it addressed was the ability to obtain coverage. So previously, pre-existing conditions such as heart disease or cancer could be a reason that someone would not be able to obtain coverage. And this left individuals who most needed insurance because of a condition that they may have to not be able to obtain coverage because of this pre-existing condition. And the reason insurance companies did this was to lower their costs. They would deny individuals who would bring them more risk, because bringing on more risk would increase their cost because these individuals may use more healthcare services. So with the ACA, people are no longer allowed to deny coverage based on a pre-existing condition. The third problem that's addressed is problems with covered services. So individuals in the past there was no really set out system of what benefits had to be covered in a health insurance policy. And so three of the main issues with this is 3 in 4 health plans did not cover delivery and inpatient maternity care in 2013. And some other major areas that weren't covered were inpatient and outpatient substance abuse disorder services, as well as mental health services. So these were the 3 major contributors to benefits that weren't previously covered. But now the Affordable Care Act has set up 10 categories that health insurance programs must have benefits in. And so a couple examples are laboratory services, emergency services, hospitalization, mental health services, pediatric services, and so on. Basically, these are general categories that health insurance policies must have benefits in. So the main population that benefited were individuals who experienced injury, chronic disease, or illness. And these individuals are at a greater need for healthcare, and now they're able to get coverage under the Affordable Care Act. And some of the administrative ways that the private insurance market rules were accomplished. So for the pre-existing conditions, there was an insurance plan put in place to allow individuals to get coverage in between the time of 2010 when the ACA was passed and in 2014 when insurance companies must begin accepting individuals with pre-existing conditions. So this was kind of a stepping stone for individuals. It wasn't perfect. Sometimes it was still too expensive for individuals, but it was a stepping stone to making this happen. Also, within pre-existing conditions, insurance companies are not allowed to deny coverage or increase premiums, But there are a few factors that can allow them to increase premiums, which are the number of individuals enrolling, the location in the state, the age of the individual, and tobacco use. Those are the only 4 factors that can be considered in increasing premiums for an individual. No other pre-existing condition can increase the premium. The third thing that was done is for the essential health benefits. These 10 categories were given to the Secretary of Health and Human Services, and they began facilitating discussions with the states to begin establishing the benchmark plans that other plans in their state would be compared to. So these 10 categories are really broad, and you can have many different benefits within these categories. So each state kind of set up their own benchmark of what benefits they wanted to be necessary for each of these categories. It also set up that preventative services must be covered without any cost sharing. So this allowed individuals who needed these preventative healthcare needs to be covered without any extra cost to them. So some of the costs that we saw with putting these private insurance market plans into use is that there was an increase in the premiums for individuals because as the insurance companies are taking on more risk, we see an increase in the premiums. But as we have projected numbers into 2019, there's actually thought that there's going to be a decrease in the coming year. So hopefully as these numbers begin to stabilize and decrease, this will become less of an issue. There's also been some issues with financial losses and gains for insurance companies that are on the marketplace exchange. So there's been about a 10% financial loss for the plan sold in 2015. And this has begun to even out, and I think down the road we'll continue to see better outcomes for these plans, but we'll just have to kind of keep an eye on it and continue to assess that as we go forward. The main stakeholder that I saw as important for this policy were the actual insurance companies. So the ACA did a few things to bolster support from them. So first, they had grandfathered plans. So these grandfathered plans have to meet some policies set forward by the ACA. They must provide insurance for adult dependents up to 26 years of age. They cannot have pre-existing conditions, have children denied for pre-existing conditions, but adults can still be denied for pre-existing conditions. And there's some other lifetime and annual limits that are allowed and not allowed. So there's kind of a balance there of some of the ACA policies must be met and some they're a little lenient on for these grandfathered plans, but as we've seen time gone on, there's been less enrollment in these plans. The ACA also tried to kind of offset the cost of taking on these higher risk individuals. So they did this by shifting money from insurers with lower risk enrollee profiles to push money to higher risk enrollee profiles. There's also some temporary plans put in place to do reinsurance for high risk individuals that was supported by the government. We also had a risk corridor where insurance companies were kind of buffered from either having extremes of low or high gains and losses. So as we're evaluating this, the main benefit of the private insurance market rules is that it allows individuals who were not able to get coverage to now get coverage. They can obtain and maintain that coverage. One of the main deficiencies is these rising costs and premiums that I discussed, but hopefully these are beginning to stabilize out. One of the main things I could see us improve is that there is a navigator program that helps educate do outreach and enroll individuals, and especially individuals with pre-existing conditions and other high-risk populations. They need help navigating which programs are actually going to benefit them the most, which programs are best for them. Some individuals didn't know that they qualified for CHIP and Medicare and things like that, and the Navigator program really helped them be able to work through these and actually enroll in insurance plans that were best for them. And as we've seen an 84% decrease in funding for the Navigator program, we've seen a decrease in people who are enrolling. And so I think it's really important for us to bolster this program and support people enrolling, especially in these vulnerable populations who may need more help navigating the process, as well as possibly increasing the window, because this year we had the smallest window for enrollment in the healthcare marketplace. So really working through some of these things and meeting the private insurance market rule focus of obtaining and maintaining health insurance for these vulnerable populations who weren't able to before is really important. So I really appreciate you all listening, and I enjoyed class with you, and I hope you have a wonderful Christmas break. Thanks so much.